Hi, my name is Anna May. I'm an 8th semester nursing student. Today is January 22nd, 2019, and the time is 1600. Today I'm going to demonstrate to you how to perform a central line dressing. Prior to performing this procedure, I should assess my patient. I should know the location of the central line and all those necessary information prior to the procedure. After that, also it is important to note that I should have my order for that. Then I'm gonna gather all the necessary supplies for this procedure. For this procedure, I need a sterile central line dressing change tray, 2 sets of masks, one for me and one for my client, and some clean gloves. Now that I have that ready, I'm gonna go ahead and get into my client's room. Knock, knock, knock. Privacy. Of course, hand hygiene. Introduce myself and identify my client using the 2 patient identifiers, and then explain the procedure to the client and how he can help me. In this case, I will ask my client to, after that, I'm going to ask my client to put on this mask. Just like that. So 1 second, it will be on. Also, it is very important to emphasize to the client to face in the opposite direction just to minimize the transmission of bacteria or anything of that nature. So since the Mediport is on the left side, I will ask my client to turn his head on the right side. Then I'm gonna go ahead and put in mine. And then, but for the sake of this video, I'm not gonna put that on just because my voice will sound muffled. So I'm just gonna leave that on, pretending that I have it on. Then I'm gonna don clean gloves. Then, with my client sitting upright and the neck or head faces to the opposite direction, I'm gonna pull this dressing gently following or towards the direction of the device. Like in this case, I am pulling it little by little towards the center, making sure that I'm not causing any further skin breakdown of the patient, because that could be detrimental with this condition, having the device connected to the central line. So very gently, making sure I'm not pulling the device also. Then throw that in the trash. At this point, it is very crucial to inspect the characteristic of the site, making sure there is no redness, inflammation, or any signs of infection. And if there is signs of infection, I would go ahead and grab a sample and send it to the lab so the doctor can intervene it further. Okay, now, after that, hand hygiene. And then I'm gonna set up my sterile field. With this sterile dressing, I'm gonna open it away from me, making sure that I only have 1 inch margin in between, and grab this sterile gloves. This sterile gloves, opening it this way, understanding that I only have 1 inch margin, and then following a gloves to gloves, skin to skin technique, I am grabbing it, making sure there is no rolled or anything of that nature. And then also, in this case, just like that. Now that I have that on, I'm gonna go ahead and grab this floral prep. After activate it, you'll hear a click, and then start cleaning the site. Following a vertical and horizontal fashion, I have to clean it vertically, horizontally about 2 to 4 inches around the side, and about 30 seconds. Just like that, and then just like that. Now I'm gonna throw that. Now that I have that ready, I'm gonna go ahead and put the new sterile dressing. To do that, I'm gonna grab this. Tuck it down. With this clear dressing, facing in this direction, making sure that everything is covered, being the side as the center of the dressing, and then I'll start pulling this part. Again, paying attention to the skin. Then at the end of this dressing, I have this little thing, a label. This one, what I'm gonna do is I'm gonna stick the label here, just it will tell me or the other nurse that it's been dressed. Put it on the side and then write my initial date and then and time. After this, I'm gonna go ahead and document all the procedure and how my client tolerated the procedure. Thank you.